Good morning and welcome to Radio Friends on Tuesday, May the 19th. Pleasure to have you with us. I'm coming here from my house in northern Boone County, and on the phone I've got Heather Harlan. Good to have you here, Heather.
Good morning, Paul. It's great to be here. I can't believe May is already more than half over.
Yes, that's the thing. And Heather is talking about the Missouri Child Psychiatry Access Project, known as what?
MO-CPAP.
MO-CPAP. Okay.
Right.
May is Mental Health Awareness Month, and it's important for both adults and children. What do you want to say about that?
Well, thank you again for reminding us. And we've just been always so appreciative, Paul, of your concern about the mental health of all of us. Today, I'd specifically like to focus on children's mental health. 2 weeks ago in Missouri, our governor declared it as Children's Mental Health Awareness Week. And I want your listeners, if they're interested in children's mental health, get a pen and paper because there's some information later they're going to want to jot down.
Okay.
So I think it's important to know that according to NAMI, the National Alliance on Mental Illness, 1 in 4 children may be experiencing behavioral problems, and we think that's probably going to increase due to our situation. And, you know, Paul, a lot of families have to wait many months for their child to see a psychiatrist because there's a national shortage. In Missouri, we only have 146 child and adolescent psychiatrists to treat over 1,000 children in our state who are seeking help.
Mm.
And that's only about a third of the children who need treatment. So the Missouri Foundation for Health and the Health Resources Services Administration are funding the Missouri Child Psychiatry Access Project. And our leadership is someone that you've met, Lane Young-Walker, MD, who's a child and adolescent psychiatrist herself. And, you know, she's the chair of the Department of Psychiatry at the university.
Uh-huh.
And here's the heart of it, Paul. In our approach, we recognize the suitability of primary care providers for behavioral health. Now, what do I mean by that? You know, your listeners may be wondering. Well, it's knowing that a child's pediatrician, pediatric nurse practitioner, a family doctor could be the best place, actually, to start looking for help if your child seems to be showing some signs of depression, anxiety, attention deficit disorder, or some other behavioral health issue. And why is that? Well, there are at least 3 things that we know and we're using in this project. One is that patients already feel more comfortable and trusting of a primary care provider. Don't you feel more comfortable, Paul, when you go to a doctor you already know?
Yeah, I do. So what do you think?
Well, yeah, and well, of course. So, and children wouldn't be any different to feel more comfortable. So we know that. So they're more comfortable. Primary care providers also have opportunity for prevention and screening. And finally, addressing psychiatric issues in primary care settings can help address obstacles of stigma. And a lot of families encounter this when they're trying to seek help. So is this a new idea?
Well,
is this a new idea? Yeah.
Is it? I was going to ask you, what are the changes that you look for in your children when you decide that you need to seek help?
Right, and I've got that listed. I'm gonna get right to that. So one of the things is that this isn't a new idea. I want them to know that is our response, and it's based off a national model of best practices. In Massachusetts and about 37 states offer it now. So we really offer support such as a phone consultation for those and extra training, maybe for the pediatric primary care providers to help manage mild and moderate health situations. And it doesn't provide direct services, Paul. We want people to know that. But we are offering professional supports to the pediatric care providers. So here's what I want your listeners to notice and that they can do to notice about the child's behavior, because a lot of people are paying close attention to their children. And so this is where I want them to pull out their pen and paper. Here are the changes in your child's behavior that might signal a need to check in with the doctor. If your child is depressed or irritable, little interest or pleasure in doing things, changes in sleeping and eating patterns, trouble concentrating, and of course, talk about wishing they were dead or harming themselves. Now, having noted that, what should a parent or caregiver for children or adolescents do? Well, first, we want to encourage you to know that first you can contact your child's primary care provider. Share your observations and the reasons that you're concerned about your child. Secondly, you as a parent or caregiver can request a mental health screening. A screening is just a short set of questions, Paul, that helps determine if any problems are consistent with a behavioral health issue, and this helps them know if it might need further investigation or treatment. Finally, you can ask to see if your child's primary care provider is enrolled in the Missouri Child Psychiatry Access Project. It's available at no cost, and if your child is grappling with mild or moderate behavioral health issues, the primary care provider you and your child already know could be an easily accessible, effective source of help right there close to your community.
Now, what happens, Heather, if your primary care provider is not enrolled in this?
Well, you can ask them if they are, encourage them to look at the opportunity. They can just do an internet search, Missouri Child Psychiatry Access Project. It's available at no cost to primary care providers across the state. So you can ask. A lot of them, we're still working. They're all very busy, as you can imagine, trying to inform them and let them know that. But we're wanting to encourage people. We want to encourage people to know that that health care might be available right there in your community. One doctor had a client, a patient he was referring, and realized it would be 6 to 9 months before this child received help, and realized enrolled in the project and was able to help the child immediately. So we feel like it's saving lives in the innovative program that it is. And it's just our vision, Missouri Child Psychiatry Access Project, write that down, to offer more tools to your child's health care providers, toolbox to address behavioral health concerns. Yeah.
Thank you, Heather. We're out of time, but I appreciate the information today.
Hey, thanks so much, Paul. It's you too. Bye-bye.
Bye-bye. See you next time on Radio Friends.